Hi everyone, this is Dr. Madhuri from Team MDSCONQUER. I think everything is going good. So now we'll see the temperature regulation in this video. These are the contents of this temperature regulation, which includes from the introduction to the references. So as all of us know that temperature is very important aspect in the form of to maintain the homeostasis, and we all these humans and everyone will have a adaptation for varying climatic conditions. So this is the classification of temperature by animals. I mean, based on the temperature, animals may be of homeothermic or a poikilothermic animals. So if you see here, there are heterotherms, homeotherms, endotherms, and ectotherms. Ectotherms which rely on heat from the environment, whereas homeotherms keep body temperature constant. Heterotherms will allow body temperature to fluctuate, and endotherms will produce their own heat. So these are the examples given for each type of classification. So this body temperature can be measured by in many ways from the different parts like mouth, axilla, rectum, over the skin and ear. So this thing flowchart you have to write in the examination. That means where that can be measured, temperature can be measured. And this box is very important. It will show the temperature, I mean the normal body temperature, oral, rectal, axillary, ear and core temperature, and this is the age, and this is a range of temperature. So this table is important for you. Then coming to the instruments which are used in this body temperature: oral thermometer, tympanic, forehead, basal and pacifier thermometer. So these are all other types of thermometers which are used for measuring the body temperature. Coming to the variations of the body temperature, any physiological activity or anything in our body will have two types of variations, whether in a normal variations that is seen in physiological states and a pathological variation that can be seen in the diseased state. So for this temperature also, there are few conditions where you will have physiological changes like age, sex. I mean, in the previous table, you have seen a different age, you'll have the different temperature, and sex also. And for the male and female, you'll have the different temperature, and based upon the variation, and even after the meals, there will be increase in the temperature. So these are the physiological variations we have to mention in the exam. And a few other physiological variations like during exercise, sleep, emotion and menstrual cycle also, there will be physiological variations in the temperature which will be normal for all the individuals. So that physiological part has been done. So this pathological part is very important, which may be because of hyperthermia or hypothermia, that means increased body temperature or decreased body temperature. And as heat, I mean like there will be of increased or a decreased body temperature in the pathological state, heat should be balanced in our body. So this is maybe because of heat gain in the body or heat loss in the from the body. These two should be maintained. So heat gain or production in the body may be because of metabolic activities or any muscular activity or any hormonal activity, radiation from the heat, shivering and brown fat tissue. We'll see these things in the next slides. So you can see here, I think this is very easy to draw also. So here you can see evaporation from the body, convection from the body, and this is mainly because of the muscle contraction, and conduction from the ground, and radiation, and because of this radiation coming from the sun. So these are the different types of methods which help in heat loss and heat gain from the body. And this is a physiological thing where this our temperature is maintained by here the hypothalamus, where it regulates the pituitary gland, then coming to the thyroid gland which produce the thyroxine, increased metabolic rate. So that because of this hypothalamic temperature, you'll see in Adrenal glands, that is increased metabolic rate. Sweat glands, you'll see the perspiration or the sweat formation, and again it acts on the skin arterioles, which leads to constriction or dilation of the blood, and these also act on skeletal muscles, and this will produce the movement of shivering. Hence this is the physiological method where the skin temperature is maintained, and this flow chart is important and easy. You can draw in the examination also. So you can see here this shivering generates the heat from the skeletal muscle as it contracts involuntarily. Then coming to the fat and lean persons, in fat and lean persons, how it will be. So large fat droplet will be there, whereas many fat droplets will be there. So here this gene activators of brown fat, we have seen that brown fat helps in the mediation of temperature. So these are the gene activators of brown fat, which includes PGCA1, heme oxygenase 1, and fibroblast growth factor, and also the other things like cold, iron, that means the insulin, stress, and thyroid hormone also help, modulate the temperature. Then coming to the heat loss from the body, we have seen all the mechanisms where heat gain. Now these are the heat loss from the body, that is conduction, radiation, convection, evaporation, and panting. So this is representing this will represent the convection here, conduction from the ground, and evaporation from the body, and radiation from the other sources. Conduction means energy is transformed by the direct contact. Convection means energy is transformed by the motion of the molecules. Evaporation, it will perspirate from the skin or the sweat glands. And coming to the regulation of the body temperature, as we have seen long back the flow chart, right? So this hypothalamus will be of a heat gain center and the heat loss center, which can be act in the two ways. So these are the nuclei of hypothalamus, where you can see the paraventricular nucleus, water balance with the stress, and this posterior hypothalamic area will help in the shivering, and then here this supraoptic nuclei help in the water balance, and this anterior hypothalamic area is very important because it helps in the body temperature regulation. So you can write this, you can mention this types of nuclei, and anterior hypothalamic area, which helps in the maintenance of body temperature. And if you go to this hypothalamic deep brain temperature, it will cause the central and thermoreceptors, which acts as a thermoregulatory center. And in periphery, you'll have the skin temperature maintained by peripheral thermoreceptors. And this the central thermoreceptors will affect the organs like skin arterioles, skeletal muscle, and sweat glands, which leads to the core body temperature. Remember guys, the thing is, you can impress the uh, examiners with your answer by this flow charts or few diagrams only. Don't write in a large paragraphs and everything. Mention with a small and sweet points, or within the flow charts or with the diagrams. So here you can see this hypothalamic temperature sensitive center. What is posterior thalamus and anterior hypothalamus? It acts as a heat lossing, it acts as a heat promoting center. And because of heat promoting center, cutaneous vasoconstriction he will be there, cutaneous vasodilation, increased metabolism will be there, no adrenal stimulation. You will see shivering here, and whereas sweating here. Then coming to the heat loss center, this is because of the preoptic nucleus of anterior hypothalamus. Heat gain center is posterior hypothalamic. You can mention these nuclei and the centers in your examination if temperature regulation is given. And mechanism of temperature regulation can be seen when their body temperature increases or when body temperature decreases. So when body temperature increases, this blood temperature increases, stimulates the thermoreceptors, which will again bring to back to the normal. When body temperature increases, you can see here that warmth receptors from the skin will go and act on the preoptic and anterior hypothalamic nuclei, which act on the posterior hypothalamus, then inhibition of the sympathetic nervous system, which finally leads to vasodilation, sweating. and again this will lead to the normal body temperature, and then again in the cyclic range the increased body temperature, then by the warmth receptors from the skin and deep viscera are stimulated. So this is a mechanism where you can see when body temperature, what happens when a body temperature increases. So promotion of heat loss can be by increasing the secretion of sweat and by inhibiting the sympathetic centers in the posterior hypothalamus. And promotion of this thing can be cutaneous vasodilation, which leads to increased blood flow, excessive sweating, heat loss increased through sweating, and decreased body temperature. So we have seen what happens when the body temperature is increased. Now we'll see what happens when body temperature decreases. Then it will be like prevention of the heat loss, and then promotion of the heat protection can be seen. And prevention of the heat loss is through sympathetic center, which cause vasoconstriction and which will decrease the blood flow to the skin. Whereas if you see promotion of the heat protection, if body temperature is low, heat gain center stimulates primary motor, then enormous heat can be produced. And you can see here the sympathetic center activates heat gain centers, that is adrenaline secretion can be seen, or a thyrotropin hormone can be secretion can be seen, which accelerate the cellular activity and increase the release of TSH. Then there will be release of thyroxine, and there will be accelerates the metabolic activity and which increases the temperature. So this explains the normal body temperature. You can see here this will decrease the body temperature and this increase the body temperature. Stimulation of the heat gain center, stimulation of the heat. So if there is increased sympathetic activity or shivering, here there will be of no shivering and inhibition of sympathetic activity. This entire flowchart describes the previous events which we have described or learned. So coming to the applied aspects, so if you can take the screenshot of this thing is very important. Then coming to the applied aspects, two applied aspects we can learn, that is hypothermia and hypothermia. Hypothermia is nothing but the fever, right? So fever there will be of three types: low grade fever, moderate grade fever, and the high grade fever. And you can see the temperature ranges here. You can, in this thing you can see the temperature ranges, that is low grade fever 39 degrees Celsius, whereas moderating fever 39 to 40 degree, high grade fever is 40 degrees Celsius to 42 degrees Celsius. Then coming to the pathogenesis of fever, maybe because of this hypothalamic set point is increased, then patients feel cold, then increased thermogenesis can be seen, and there will be a rise in body temperature. So this flowcharts describe, or this will describe how the, I mean like hypothermia regulation of the mechanism. Then coming to the signs and symptoms, as we know, the headache will be there, sweating, shivering, all these are the signs and symptoms of hypothermia or fever. So approach to the patient, we have to take the history of the patient, physical examination, laboratory investigation, because there are several reasons for the fever. So we can approach the patient like this. Then treatment will be of use of antipyretics, and we have to reduce the oxygen demand and use of cooling blanket. This is the main basic treatments. Then one important hypothermia is seen, that is malignant hypothermia, and this is mainly because of few anesthetic agents also. You can see tachycardia and tachypnea in this malignant hypothermia. So this may be because of mutation in this RYR1 gene. You can see here, and you can mention this gene in the exam. And this can be treated by this recognition of the condition, immediate management. I mean like hyperventilate the patient with 100% oxygen. Then the important drug here will be of dantrolene sodium, so which is given, you can mention in the exam. Then that is of regarding hyperthermia. Then coming to the hypothermia, hypothermia is of below 35 degrees Celsius. So these all are the causes of hypothermia. Again, the classification of hypothermia based on the temperature will be like this: mild hypothermia, moderate and severe hypothermia. And so these are the, this box will give the symptoms of mild, moderate, and severe hypothermias. You can write the symptoms and treat the hypothermia like this. First, you have to medical attention as soon as possible. Then warm room or a shelter. Then remove any wet clothing is there. Warm them and place areas affected of frostbite into warm to touch water. Then actually this temperature regulation is very important because the NSAIDs which you will use are usually help in the decrease the body temperature. So you can mention the drugs which are used for regulation of body temperature. So these are the drugs, and here you can mention the mechanism of action of all these NSAIDs. Like NSAID blocks the COX inhibitors, which will block the prostaglandin action, which will help in the reduction of the body temperature. So examiners expect you to mention these mechanism of action of prostaglandins also, because we are using these NSAIDs in our daily clinical practice. So you have to compulsorily mention these drugs also as in the applied aspects. So at the end, you have to mention all the references, basic references in the which were taken from the physiology textbook or a pathology textbook and a pharmacology textbook, as you will write the drug names. Okay.